Hi, everybody. My name is Dr. Zuri Murrell, and I'm here at Cedars Sinai, and I'm a colorectal surgeon. And I'm very excited to be here because this is Colorectal Cancer Awareness Month. I want everybody to say the words colon, rectum, anus. I want you to say that I will not die from fear, I will not die from embarrassment, and I'm excited for us to all learn about things we can do. What is colorectal cancer? And things that we can do to help prevent it. So I always start with some statistics that can be a little bit sobering for some patients and just for people to hear, but I really want you to take from this that we can make a positive change and an impact on these statistics. So colorectal cancer is the third most common cancer in Americans in terms of diagnosis in both men and women. And it's the second most common cause of cancer-related death in America. There'll be about 150,000 newly diagnosed cases and about 50,000 deaths. However, we can prevent this disease. There's things that we can do, such as number one, there's things that we can impact, and there's things that we cannot impact. So you can impact your age, and colorectal cancer is still higher amongst people over the age of 50. However, there's been increasing rates in patients lower than the age of 50, and we'll talk about that a little later. You can't do anything about your race. African Americans have a higher rate of colorectal cancer, but things that we can do are, number one, improving our nutrition, decreasing obesity, increasing our physical activity, and decreasing our alcohol intake. These are all things that we can do to have a positive impact and help to prevent us from getting colorectal cancer, in addition to getting appropriate screening. And so we're going to start with some questions. Someone is going to be reading me the questions, and I will repeat them to you.
When should people start getting colonoscopies?
So the question is, when should people start getting colonoscopies? Now, this is a very important question, and it really goes to the heart of knowing our family history. So if you look at guidelines, the American Cancer Society has just actually decreased the age from 50 to 45, which is something that we're all on board with. At age 45 is when colonoscopy should start if you have no symptoms and you have no family history. Now, when I talk about family history, people often ask, well, is it just a family history of cancer? But no. If you have a family history of someone with 3 to 4 to 5 polyps that were found, such as like my father, for instance, he had about 5 polyps that were found on his colonoscopy. So I knew I needed a colonoscopy sooner. Now I'm 44 years old. About a year and a half ago, I had a colonoscopy because I knew my father had a large number of polyps at a young age. And guess what? Even though I try to eat healthy, even though I eat a lot of fruits and vegetables, I still had a large precancerous polyp on the right side of my colon that if I would have waited, I would have had colorectal cancer. And so more importantly than these guidelines, the most important thing is knowing your family history. And so that means that once you had a colonoscopy, you actually share the results with your children. My kids hear about my colon history all the time, and I laugh because to this day, this morning, my youngest daughter, Gia, brought me my smoothie to make sure I get my fiber every single day. My kids are on top of this because they hear me harp on it all the time. They know their colon, they know my colon history, and thus they will know their colon history. Next question.
What's your advice for someone afraid of a colonoscopy?
What's my advice for somebody afraid of a colonoscopy? So this is what I kind of get this question all the time, and I try to let people know that you don't feel anything during a colonoscopy because you have anesthesiology, you get medication, you go to sleep, you wake up, and that's it. Traditionally, the hardest part of a colonoscopy is like the day before. The day before you take a bowel prep, which helps to clean you out. Now this used to be, and I'll be very honest, this used to be very, very difficult because it tasted horrible. But there's so many different preps now. There's so many different flavors. I mean, the prep that I often use is basically a laxative solution mixed with Gatorade Light. And that is, everybody, and now granted, you drink a lot of Gatorade afterwards, but it is very doable and it doesn't make you nauseous and it helps to totally clean out your system. And people never really complain about the colonoscopy. They wake up most of the time and they say, I had a great sleep. And I tell them that, guess what? We didn't find any polyps, you're good to go. Or, hey, we found some polyps, we were able to take the polyps out. You are now going to be cancer free and I'll see you again in about 5 years. And so I also still having this discussion, there are some patients who still remain reticent to having a colonoscopy. And then that's when I bring up family. I ask them, do you love your wife? Do you love your husband? Do you love your kids? Because if you don't do it for yourself, you should do it for them. You do it for your loved ones because you want your family to know, hey, I had some polyps, you need to get this done early, daughter, son. And so you're actually helping your generation. You're helping your life, your bloodline remain healthy throughout the future. And so those are the ways that I let patients know who are afraid to get colonoscopies that it's about more than themselves. It's about their families, and it's just very important to do.
Are there early symptoms of colon cancer?
So that's a great question. The question is, are there early symptoms of colon cancer? So this is the hard part about colon cancer, is that the early symptoms are very non-distinct. The most common symptoms for colon cancer, we're going to divide colon cancer into rectal cancer, and we're going to divide colon cancer from rectal cancer. So talking about colon cancer, it's basically a change in bowel habits and occasional abdominal pain. Now, how many people have had occasional abdominal pain? Everyone. How many people have had maybe an occasional bout of diarrhea versus a bout of constipation? It is important to know that when you have these changes, if they are persistent, meaning that you've had abdominal pain for almost about a month, you usually go to the bathroom and have a bowel movement once a day, and now it's once every 4 days, and it's been like that for about a month. It's really the length of time that you've noticed these changes that need to be evaluated. So if you have these changes and they've lasted for a month, that's when you need to see your doctor to get further worked up. Now, when you deal with rectal cancer, the most common symptom is rectal bleeding. Now, most people have had some bout of rectal bleeding, whether they've had a hard bowel movement, they can have some anal pain, rectal pain, and they may notice a little bit of blood. But if the blood is mixed in stool, and it's hard, if you've never had that, people say, well, how would I know? You'll know. If you look at your stool, which I always recommend looking at your stool before you flush the toilet, you would be able to see that. And if you notice blood on the toilet tissue, now, a lot of times when there is bright red blood and blood on the toilet tissue, most of the time it is either a hemorrhoid or a fissure. But if this keeps happening and it happens over the course of a month and you've tried over-the-counter remedies and things like that and it's not getting better, you need to be evaluated by a physician. Don't just assume. If it's longer than a month, get it checked out. I wish I knew something that rhymed with that. Maybe one of you guys can help me. I need a catchy phrase for that. But that's really the key. The key is if you have persistent changes, that's when you need to be evaluated by a physician because these symptoms are so nondescript.
Who is most at risk for colon cancer?
So who's most at risk for colon cancer? And this is a very interesting question. So males have slightly a higher lifetime risk than females. It's about 4.49% for males in America and about 4.12% for females. African Americans have the highest risk, followed by Caucasians, followed by Latinos, okay? But what's very interesting, especially when you look at, the questions are why, but especially when you look at African Americans. So African Americans have the highest rate in America, but if you look in the world, Africans, i.e. Nigeria and Uganda, have some of the lowest rates of colon cancer in the world. Now there's almost nothing separating the genes in this particular area. So what's the difference? Well, the difference is, to me, the most powerful thing about this disease process. It's really diet and obesity rates. We eat so much processed food in this country, and there's such a large obesity epidemic in this country that this is what is impacting our colorectal cancer rates. The good news is we're seeing a decrease in older generations year after year after year in rates of colorectal cancer. But from about 2007 to 2016, which are where these stats are available, there's been a 1% increase per year in colorectal cancer deaths in patients younger than 50. Now, what correlates with that? Why is that happening? Well, what we're seeing is a huge increase in our obesity rates in these same populations. And you don't see that anywhere else throughout the world. We eat a lot of meat here, and we do know that a diet high in animal fat, animal protein, red meats correlate with colon cancer. There's not a high consumption in Uganda and Nigeria of meat. There's not a high consumption of processed foods, and there's hardly any obesity in these areas because of a lot of physical activity, physical labor, things of that nature. So knowing this information, this can actually be powerful. If we reduce our red meat intake, we increase our fruits and vegetables. We used to think you needed 20 to 25 grams of fiber a day. What we really need is about 30 grams of fiber a day. We increase our water intake. we do all of these things, this can dramatically lower our risk for colorectal cancer. And really the key is, you guys, and this is the part that is the good news and the bad news, we're starting to really hone in and know that obesity, obviously we knew it wasn't good, but we can quantitate how it is not good. Yet we're seeing a huge obesity epidemic in this country in our children. If you could take this knowledge back and start eating healthier, decreasing your red meat intake. If you like to eat red meat, I eat red meat personally about once a month, okay? If you eat red meat 4 times a week and you go down to even 2 times a week, once a week, that can still also help you decrease your chance of getting colorectal cancer. And physical activity is a must. I got my Fitbit on. We use Fitbit now in post-operative patients. We're trying to really, there's so many different ways and kind of innovative ways we can monitor our physical activity. We can monitor our calorie and nutrition. You can make it a game. You can actually try to see, you and your loved ones, me and my kids, we've actually done this before. Try to see how much fiber you can get in a day. Things like that. You can actually make it work for you. The biggest thing is, and somebody just mentioned this on Facebook, is nitrates. Yeah, nitrates are bad for you, and that's really what we find in processed foods such as cold cuts, things like that. The way we digest nitrates in our body into a nitrosamine, which is something we like to refer to as a pro-carcinogen, pro-cancer, something that helps to lead to cancer. So decreasing that in and of itself can help us tremendously decrease our chance for colorectal cancer.
So she wants to know, are there different colonoscopy guidelines for men and women?
No, so that's a great question. Are there different colonoscopy guidelines for men and women? Really, the difference in the rates is very tiny, and no, there is no difference in the colonoscopy recommendations. Once again, in this country, it's age 45. If you have no family history and no symptoms. If you have symptoms, blood mixed in stool, chronic bleeding, if you have a family history, such as a first-degree relative who got colorectal cancer, then that changes everything. Then you can get screening colonoscopies done earlier. But it's important to remember something. Screening colonoscopies and screening tests are done when you have no symptoms. Diagnostic tests are done when you do have an issue. And that's something that's also very important. So if you're under the age of 45 and you're having blood mixed in stool, don't just say, well, I'm too young for a colonoscopy. That's not true. You have an issue that needs to be evaluated, and that's something that's very important to remember.
Julie wants to know, what's the best prep if you have a gastric sleeve?
What is the best prep if you have a gastric sleeve? Well, that's a great question. The prep that I usually use for that, and this is just something that I have from experience, is just the Miralax and Gatorade Light, G2, or even coconut water. Something like that does not have a lot of sugar will help you tremendously in terms of being able to tolerate a bowel prep.
Are there foods you can eat more of to improve colon health?
That's a great question. Are there foods that you can eat more of to improve colon health? So we always talk about fiber, and water. So why is fiber important? So fiber is important for 2 things. When I usually ask this question, people always, a lot of people give the wrong answer, but we're becoming more and more educated now, so I'm getting more and more of the right answers. It's what's the point of the colon? A lot of people say it's to make poop. It's not to make poop. The point of the colon is actually to reabsorb water, okay? And so what does fiber do? So fiber, when we eat foods that are rich in fiber or Metamucil, things of that nature, it helps to hold water in the colon, okay? So why is that important? Well, you want to decrease something called your colonic transit time. Everything we eat, everything that we consume, after it's absorbed in the small intestine, so actually we masticate, we chew it up with our teeth, we swallow it, it goes down to our esophagus, it goes to the stomach. The stomach's job is to actually has acid in it to actually break down the nutrients, and then it goes into the small intestine where all of the absorption happens. Next, we get the waste mixed with water into the colon. The colon's job is then to reabsorb the water, all the water that the body needs, and then to empty out the waste in the quickest way possible. So fiber helps to hold water in the colon, thus decreasing our colonic transit time. The colonic transit time is the time that something gets into the colon till it is expelled from the body. And so fiber helps to have that happen as quick as possible, thus not allowing basically the nitrates and all of the unhealthy toxins to remain in our colon for a large period of time. So fiber is very helpful in terms of being very positive for the colon. That's number one. Number two is there's a lot of probiotics, certain ones that have certain bacteria that help to provide nutrients to our colon, and I'm a big firm believer in those also. The most important thing you can do is that fiber and water help to avoid constipation, thus helping to decrease the amount of time toxins are in the colon, thus providing good colon nutrition and health by helping to evacuate toxins out as quick as possible.
Are nuts and seeds good for your colon, or do they upset it?
So that's a great question. Do nuts and seeds upset the colon, and are they good for the colon? So there's really, the whole issue with nuts and seeds came about, there's a disease called diverticulitis. So diverticuli are little outpouchings that we get in our colon, especially in the distal part of our colon called the sigmoid, which is secondary to our chronic constipatory state in this country. Okay, basically because the colon is so narrow there, and because we over our lifetime are forcing our bowel movements, we get these outpouchings. If you look at just Americans, about 85% of us have diverticuli at some point before we die. Now, because you have diverticuli, that does not mean you get diverticulitis. Diverticulitis is inflammation of the diverticuli. About 20% of people, or about 15% of people, will end up having some form of that. About 5% end up needing to get treated. We used to think that nuts and seeds precipitated and caused diverticulitis. We know that this is not true. If you're somebody who can't tolerate nuts and seeds, that could just be you. That could just be some form of an allergy. But in and of themselves, they are not bad for the colon.
And the last question, you mentioned polyps. What is a polyp?
Okay, so the question is, what's a polyp? And this kind of allows me to talk about what is colorectal cancer. So colorectal cancer, and what is cancer in general? Cancer is when the cells lose the ability to stop dividing. They forget to stop growing. So the reason I'm 6'2", and the reason my fingers are this length versus this length, is because my cells knew when to stop growing. Cancer cells, as one of my patients told me, are just stupid. And that's what happens. They lose their intelligence to know when they stop dividing. And so when these cells divide, they keep growing. They take all the nutrients from other parts of your bodies. They keep growing. And sometimes they outgrow their blood supply. They fall off. That's why you can have bleeding, things of that nature with cancer cells. Now, all colorectal cancer starts as these small little growths called polyps. Now, what's important to know is that most polyps have no symptoms until they get really, really large, or they're almost cancer, or they turn into cancer. And so a colonoscopy allows you to visualize the walls of the colon, see the colon, and then actually remove polyps during the colonoscopy, thus preventing cancer. So it takes from time 0 to time about 7 years, we think, to go from nothing to a polyp, and sometimes 7 to 10 years from nothing to a cancer. And so the key really with a colonoscopy is not just looking for cancer, it's preventing cancer. It's the only test a man and a woman can have that actually help to prevent cancer, because you see a polyp and you take it out before it becomes cancer. I would like to say that thank you guys so much for joining. Any other questions, you can always write down in the comment section. And once again, I want you guys to remember, this is Colorectal Cancer Awareness Month. This gives you a reason to talk about colon cancer, rectal cancer, anal cancer at the dining room table, because that's when you have people's attention. It's very important. I don't care where you go to get screened. We hope you come here to Cedars Sinai to get taken care of, but more importantly than that, we hope you go anywhere where you can get the appropriate screening, because this is something that is near and dear to our hearts, or to the heart of our bottoms, I guess. And we really want you to get screened, and we want you to talk about this. Once you've had your colonoscopy, talk to your family about the results. If I can tell you anything else, just this should not be taboo. This is something that you can do to help your family and your generation survive a long time. Thank you so much, and God bless.